Good evening, everyone. It's my pleasure to welcome you all to another session of Leadership Rounds, where we are interacting with the leaders of the healthcare industry who have been in industry for decades now. My name is Dr. Ruchika Gambhir from Team VOH, and my guest speaker for today is a very renowned leader in the healthcare industry, experienced clinician, entrepreneur, and currently wears multiple leadership hats. To name a few, Dr. Reddy is the Country Director of Access Health International, Chairman and MD of Relisys Medical Devices, Managing Partner for IncuMed, and Chairman of Trust Health. Thank you so much, Dr. Reddy, for joining us today. Before we dive into the discussions, could you please briefly share a few lines in your introduction for our viewers?
Thanks, Ruchika. I'm a cardiologist by training. I was a co-founder of Care Group of Hospitals, and I was responsible for growing it to 16 hospitals across 6 states. I was associated with Dr. Kalam in developing India's first cardiac stent, right from its development to its animal testing to the human testing, and taking forward for further development and establishing the manufacturing facility and exporting to 20 countries. So that's the other role that I play. Then currently I took over Access Health International. Earlier I was country director, but currently I'm the global responsible for the Access Health as the CEO now. So that's the so for Access Health International, I look at myself as a doctor of health systems.
Okay.
So just like I look at patients, I look at health systems from the doctor's approach. What are the underlying diagnosis? What is the treatment? And how to give the treatment? Is it working or not working? So that's my approach to health systems and building the organization in the same fashion. So this is a brief introduction of different roles that I am playing. But despite these different roles, there is a thread connecting all these roles. The purpose for which all these efforts have been taken is basically how do we ensure that the people get quality and affordable care.
Yes.
So these are the 3 objectives: quality, access, affordability. And if you look at all these works that I am doing as a clinician, as an entrepreneur, as a hospital manager, as a health tech developer, it is only for these 3 objectives. When we worked with Kalam on the stent, his statement was simple. Why are we importing these? Why can't we make it in India? I mean, we have extensive research network in CSIR, in defense research. Why we are not putting it to use? Because unless we are self-reliant, we are not independent. We are still dependent. So we haven't gained independence if we are still dependent. Just like the space technology, just like the missile technology, just like the nuclear technology, unless the country has self-reliance, we will not be independent. So that was the catalytic movement of Dr. Kalam to trigger this activities around these 3 objectives.
Yes, sir. So I guess that really kind of marks the words of a doctor as well as an entrepreneur. And that really sounds like a great professional journey over the years you have been made. And on this note, we would like to start with the understanding that how in this contemporary business landscape, where people find it hard to manage on one enterprise, you are successfully handling multiple enterprises at the same time. Could you kindly share your experiences and elucidate on the inspiration that led you to participation in all the enterprises?
So one, as I said, it is the unifying purpose for which all these enterprises have been established. So that purpose is the anchor around which these enterprises have been established. Then how to handle all these enterprises is, I invest in first identifying the right people.
Okay.
For example, if we open a hospital in Raipur, I spent almost 3 to 4 months looking at the right people, right professionals. I was
Okay.
not looking at the buildings, actually. I was not looking at, so that investment into the right people, that will remove 50% of your burden.
Yes.
Then guiding them and mentoring them and building their capacity as an extension of your capacity. Right. So that was the second. That means the delegation, and giving the freedom when they are ready to take the delegation. Just like a pilot coach, until when the coach gains the confidence, he allows the pilot to take the flight on their own. Until that time, you'll be sitting beside.
Okay.
Okay, so you need to know when you can allow the pilot to fly the plane alone. So that's the second thing. The third thing is we always believed in bringing positives in different people together as a team, because no single person will be good at everything.
Yes.
I may be good at one thing, my colleague may be good at something. For example, I'm not a good social person, but for my leadership position, I require those social skills. So
Yes, sir.
that means I need to have somebody who has those social skills.
Yes.
So the same concept we adopted in building India's first largest cardiology team. In fact, I was responsible to lead this team of 60 cardiologists
Okay.
as a part of the care hospitals, and that was the first time cardiologists working as a team. Because normally cardiologists don't work as a team; they are independent, right?
Yes, sir.
So, but we work as a team because each one may be good at some aspects of cardiology, because cardiology itself is vast. Somebody may be good at interventions, somebody may be good at echocardiogram, somebody may be good at pediatric cardiology. But when the patient comes, if, for them to get the best care without spending more money, even if 10 of us were seeing a patient, we charge only one consultation. So that was the third thing. That means building cohesive complementary teams. Right. And fourth is as a missionary approach. I mean, as an institution building, if you have the clear purpose for which we are doing, and you convert some of these people into missionaries, I mean, that's how the religions do. They have a
Okay.
philosophy and they identify the missionaries, and the missionaries spread your philosophy.
Okay.
So these are the four elements I think might explain how I am able to compartmentalize these five enterprises in every day.
Sure, sir. So that's really inspirational and quite a different way of thinking, I'll say. While we have already mentioned that you really take care of whom you are employing for the acquisition of the employees. So it brings me to a question that with your experience, with your actually multidisciplinary action experience, spanning from hospitals to devices, to access healthcare and trust healthcare, that how do you really manage to acquire and retain the right talent, and also how do you kind of train these staff for to keep on evolving along with this expanding and the ever evolving health ecosystem.
Yeah, this is a challenging aspect of getting the right talent and building them on a continuous basis and retaining them. And I think these are the three key areas which are challenge for any organization. Right.
Yes, sir.
As a doctor, I'm also psychologist. Right? So I try
Okay.
to understand people. Then generally I look at what someone is good at rather than focusing more on what they are not good at,
Okay.
so that you can amplify what they are good at, and you may attempt to change what they are not good at. Right.
Okay.
That's one aspect of it. The second is we understanding people. I mean, why people leave organizations, right? So when they feel insecure, when they don't have the professional satisfaction or the working satisfaction, or if they have a idea. I mean, some of us want to self actualize some of our ideas, right? Dreams and ideas. Suppose they don't have a space to self actualize those dreams and ideas, they will leave because they need that space to self actualize. Then, if they are not brought, if suppose if I haven't communicated the philosophy, the purpose, the values of the organization, and the mission for which we are working to the last person, uh, unless we communicate, they don't feel that sense of belonging.
Yes.
And lastly, if you give the confidence that you are there when they require, suppose they need some help for their child's education, or some family member needed some health expense for which they were not covered, or they need some urgent financial help to marry one of their child. So it is not just a feeling of employer and employee. If you treat them as a family member, and if you care for them as you want them to care the customer, right? So that's why we used to use the adage that it is not patient first alone, it is employee first. That means if you take care of your people, they will take care of the patients.
Sir, I guess that's a really good.
Yeah,
Please.
why Tata Group does not lose people? Because they take care of them.
Yes, sir, you're right.
They get the same salary or even less salary. Similarly, as a medical professional, I mean, I used to attract professionals from academic institutions because as a medical professional, beyond some money, they require that intellectual satisfaction.
Yes.
So that means we used to have a daily academic program to attract that type of talent, right?
Okay.
So these are the some of the, I mean, there are many elements of it, how as to by deep understanding of each what somebody wants, especially a good person, you don't want to lose, and you need to understand their requirements also. It's not just for money. Many people mistake that money is the thing. No, money is money is to for them to live comfortably, but money is not the sole thing. So these are a kind of a and it is not everything fits everybody. Okay, so you
Yes.
have to individualize, understand a person, what they require. Some people are totally independent, they don't want to be told. Some people are totally dependent, unless you tell them they don't work.
Yes.
So I would say you have to be a good psychologist to retain people.
Yes, I guess you are definitely right. And I guess that's one of the biggest leadership lesson everyone needs to learn when it comes to employing someone. Because you're right, everyone is different. So there is not, we cannot just scale everyone on the same map. So
Right.
it's really different. So while we are talking about this, it sounds like a great leadership roles from your end. So with great leadership definitely comes the great responsibilities, and one of the most important ones is to take care of the drastic climate change. Being in the healthcare industry, it is a responsibility of the healthcare professionals to address the climate change and its impact on health. Could you please elaborate on what Access Health is contributing in the domain of climate change and health? Additionally, do you think this initiative should be emphasized by the young and the upcoming entrepreneurs to build upon?
Yeah, so Access Health, in fact, we have a global learning program called Global Learning Collaborative for Health Resilience. As a part of that, we are exploring different thematic areas. So one of the thematic areas are what are the various threats which will threaten the public health. I mean, pandemics we know. We are also witnessing the geopolitical conflicts and the mass migrations. Then we are witnessing the natural disasters, the wildfires, volcanic eruptions, climate change. Then we are also witnessing the flooding that we recently saw in Chennai.
Yes.
So based on that, I mean, so if there is a threat, how the health system is prepared for that threat, so that you are prepared for it. I mean, that is what is a resilience. Sometimes
Yes.
you may not prevent it, but you should be prepared for it. So that is one aspect of mitigating climate. That means adapting to the climate change. You anticipate what is likely to happen with climate change on people's health. You also anticipate what the infrastructure might face itself a challenge. For example, hospitals in urban cities, they have their diagnostic labs in the basements. They have their
Yeah.
CSSTs in the basements. They have some of the
Yes.
CT scan machines in the basement. Imagine if, and it is going to happen. We are seeing across the world, the urban flooding is happening, including the New York City that happened because the rainfall is suddenly like a cloud burst. So
Yes.
the cities are not resilient to that. That means you have to also design your infrastructure in a resilient fashion for these urban disasters. So that means how to prepare the infrastructure for the inevitable climate change that is happening. That is one aspect. The second is what are the potential health emergencies that might happen because of the climate change. One is the extremes of temperature related illnesses. The second is because of the disturbance, there will be more mixing of humans with wild animals. That means there are more chances of some of the novel pathogens to come into as a epidemics and the pandemics. So are we doing surveillance of those wild animals pathogens? So that means that one health concept comes into the picture as a part of that. Then the third is the health sector by itself. When you look at the healthcare, hospital deliveries, the drug development systems, the manufacturing systems, the transport systems, the entire supply chains, the health system accounts for anywhere from 6 to 10% of carbon load on the world as a sector. So then how do you think that you have to become carbon neutral as an industry, as a sector? How do you become? So these are the four dimensions we are looking at, access health as a thematic area. In fact, we recently conducted two, three learning thematic areas, one in Singapore and one in Indonesia, and two, three these in online. And we have an annual conclave in March with one session focusing only on climate change and health. Uh, we are also part of it COP28 as well in terms of the health and the climate change. Yeah, so this is one of the focus thematic area in addition to the universal health coverage, in addition to the health security, in addition to the health resilience. One of the focus area is preparing the health system for the climate change.
And sir, in continuation to the previous question only, I'll really like to know that how do you think public-private partnerships contribute to the initiative of addressing climate change and health?
Yeah, I think it is evident that the governments do not have money. There is no fiscal space, right? And you cannot continue to increase taxes to create fiscal space.
Awesome.
And also, there is a realization see, when there is a threat to the entire humanity, it will do nothing but forcing people to collaborate with each other. I mean, the human race evolved by that collaborative nature only. Humans
Yes.
collaborate when they face a common enemy.
Yes, sir.
Now, the common enemy is climate change.
Yes, sir, I get
It
it.
does not respect borders, right? It's not Ukraine and Russia. It is not Israel and the Hamas. So climate change is a common enemy facing the humanity. So it will be inevitable that there has to be partnership between all the stakeholders, the private for profit, private not for profit, and the public. So there's no other way. But who has to bring these people onto the table? Okay, so that is the role that, in fact, Access Health plays in healthcare. That we try to bring various stakeholders, the policymakers, the researchers, the practitioners, the civil society organizations, the self-help groups, the media. I mean, idea is because each one, when they're sitting in the same room, otherwise you will be seeing the elephant in a different way.
Yes, sir.
When everybody sees elephant as elephant, that is different.
Yes,
When
sir.
everybody sees climate change as climate, then the private for profit, there is an opportunity in working on green energy solutions, green battery. So there is so much new area of innovation, new area of opportunity. That's a big economic investment opportunity, naturally the private sector will be interested to invest into that. Once there is a policy push that we are going away from fossil fuels and we are going to support the transition to the renewable energies, naturally the industry will invest because there is a policy push. And you are already witnessing that. You are
Yes.
the biggest industrial chains in the country putting billions of dollars into these climate renewable energies, the battery solutions, hydrogen batteries. So we are already seeing that. I think it is irreversible. Already the partnership is happening. Its partnership is
Yes,
happening. Okay, so the more, yeah, I think more people should trust each other, especially in the healthcare. For example, the COVID pandemic happened. If only the public sector and the private sector meet periodically and they are willing to share their capacity, their spare capacity in terms of the beds, in terms of the doctors, in terms of the nurses, and they agree on a pooling mechanism when there is a requirement instead of doing it as some emergency thing. Suppose we know that every city has surplus beds in the private sector and overflowing in the public sector.
yes,
How you can pool these surplus beds with the demand side and have an then it's a win-win solution. So what we need is, I mean, that is what we are trying to do as an Access Health, is to connect these people and make them share the common purpose for which they are working. I mean, their approaches may be different. They're not wrong. The private sector looks at the people's health needs as an opportunity, business opportunity. The public sector looks same thing as a burden and a responsibility.
yes,
Okay, that's why you see the private sector is responsive when there is an opportunity in wellness. Wellness is growing 30%.
yes.
But public sector to invest in wellness, it's a different approach because it's the taxpayers' money they have to invest up. So these are some of the, as I mentioned, as a doctor of health systems, my diagnosis is that people have to come talk to each other.
Okay.
There should be
So,
institutional mechanisms to build relationships between the private sector and public sector. Like in Thailand,
yes.
they have a health council where all the stakeholders meet every year to have a policy planning for the next year.
So, so that sounds really interesting and quite an insightful, actually. Something which I haven't heard of or kind of thought of in that way. So, really, thank you for that. Uh, Moving on through my next question, I would like you to address an alarming issue of heart conditions. As we are witnessing a significant increase in the death rate caused by the heart conditions noticed in the last few years, and considering your expertise in the cardiovascular system, how do you think the device manufacturing companies such as yourselves uh, can support in reducing the mortality rate?
Yeah, so we look at from a kind of a life cycle approach to reduce the ultimate mortality. Life cycle approaches start from health promotion, right? Health promotion, of course, as an industry, we may not be able to contribute to the health promotion. It is the lifestyle, it is the environment, it is the social condition, economic condition. So those are the things which are at a public policy level. But as a commercial determinant, as an industry, we should not harm the people in terms. So that is at a health promotion level. Uh, at least as an access health, not as a medical device industry, we are creating kind of a program around health literacy, a self-learning literacy, as well as using social media channels, using the public health channels, public health communication channels. Health literacy is one activity that we would like to undertake as a means to reduce ultimate cardiovascular disease mortality. The second level is the primary prevention. So the primary prevention as a medical device industry, my approach is to can we design, innovate on devices which people can monitor at home, right? That means if they can calculate their future cardiovascular risk based on simple parameters, like what is their blood pressure, what is their waist circumference, what is their blood sugar, do they smoke, do they have the family history, and if their 10-year risk is say more than 10%, just educating them that you require control of hypertension, control of diabetes, and giving a statin. That will prevent more millions of deaths than any device. That is the primary prevention level. If somebody already has a heart disease, then we use the what is called secondary prevention. That means then some more drugs have to be there. Or if already there is a myocardial damage and patient is already having a heart failure and you want to prevent a sudden cardiac arrest, then we put a defibrillator. So I have taken up that program of developing indigenous defibrillators because they're very expensive. So as a company, as a medical device company, we are looking at point of care, affordable diagnostics to assess the risk as well as undertake some preventive measures, and self education programs wherein they can change their lifestyles, they can be compliant with the treatment advised to reduce the devices. Then work on some of the life-saving devices, which includes the cardiac stents and the defibrillators, the pacemakers, and also ultimately we started recently the program towards artificial heart development.
Okay.
So, but the maximum benefit, if you want where the money should go, it should start from health promotion. For example, we underestimate if we are investing into clean air, we're investing into clean cooking gas to every home. We're investing into safe drinking water to every home. We're investing into Fit India program. We're investing into Eat Health India program. They will save more millions of patients with heart attacks than stents and the catheters. Okay. So, yeah, because it is the bottom. The stents and catheters come only at the top of the pyramid. So you start from the bottom, then you will be saving much more in absolute numbers. As a percentage, yes, devices will prevent it. So as a part of this, under Access Health, we recently launched this year a Asia Pacific Cardiovascular Disease Alliance, basically to create policy awareness that why there is a should be a focus on preventing cardiovascular disease and also providing services to people with cardiovascular disease, especially the time-sensitive services like emergency acute MI. So, yeah, answering your question, we are approaching from a multiple dimensions. As I said, as a clinical service provider, as a policy researcher, as a health technology developer. So these are the three roles ultimately contributing to not just the cardiovascular disease mortality, but the overall the disease burden as well as the mortality and the morbidity at an entire system level.
So that's really an insightful answer and actually a great answer. And I guess with that question, we would like to conclude our session or our discussion. But before we part, I would really like Dr. Reddy to address our viewers who could possibly be budding entrepreneurs and young healthcare professionals. What advice would you like to give to those who wish to venture in this space?
Uh, Two things. One, they should not forget the purpose of medical profession. I mean, whoever is into medical profession, it need not be just the doctors, everybody. Even a pharmacist is a medical
Yes.
profession, a manufacturer is a medical profession, an innovator of medical device is a medical profession. So that purpose as a professional, that is professionalism. I mean, we know the knowledge of medicine, we have the skills of medicine, but we don't have professionalism. What you are expected as a health professional. So that is my fundamental thing that we have to invest in being a professional. The what is medical ethics? Because medicine is not like any other business.
Yes.
So people who are entering into medicine as a business should treat it as a different business, not as any business. The primary overarching objective is health of the person, not the return on the investment of the shareholder.
Yes.
You need to balance both. You need to cost. So these are the two fundamental things. That means you should not forget the purpose of medicine: do no harm, relieve suffering, prolong life, uh, and you have to be professional, and you have to have that continuous passion for the purpose for which we are there.
True, sir. I totally agree with you on that note. And thank you so much, Dr. Reddy, for joining us today. It was a really great pleasure to connect with you and to listen to your views and getting an inspiration from you. Thank you so much, sir.
Thank you, Ruchika. Thank you.